Okay, so I decided to do my video on the Affordable Care Act. So basically what it is it came about in 2010 and it was the biggest change for senior citizens in Medicare since 1965 when it started. It had the main goals for senior citizens is that it was going to support medical delivery that was going to lower costs for everyone involved, so for the government and for individuals with Medicare. For Medicare, it added for 65 and up, you have to be 65 to have Medicare, and you have to have it. It added free services such as like one free wellness visit a year so you could go talk with your doctor and see if you needed any other medical care at that time if you had any other concerns. And it created free health screenings, free flu shots, so it gave them more access to preventative health care. The only negative that I could find is that it requires you to have Medicare even if you have private insurance, which can be an issue for people like my parents actually that have had a retirement insurance through their job, through the state or through the municipality or whatever. Medicare becomes primary no matter what, and Medicare is not as good of an insurance as my parents own. So their insurance quality goes down a little bit because their secondary, which is their state retirement, is now secondary to Medicare. But for the average person that didn't have insurance, or if their insurance goes away at 65, then this helps them. Another thing that this new policy created is that it took away any kind of maximum amount per life. Because I guess before this, I had no idea. I've never even heard of this. There was some insurance policies had a cap on how much they would spend on a person in their entire life. So if you got up to 70, but you'd used all that money on whatever, surgeries or whatnot, then they wouldn't cover you anymore, which is insane to me. I looked at 3 different journal articles, one from Health Affairs, which showed that there was an increase of 8,400 in 2011 to 2013, 8,400 early stage colorectal cancer screenings and positive. So they found out that they had cancer among senior citizens in those 2 years. And I didn't know this either, but colorectal cancer is the second behind breast cancer. So 8,400 more people found out that they had colorectal cancer in 2011 to 2013, which is an increase of 8% in just 2 years. There was no significant change in breast cancer, but that is thought to be because the out-of-pocket savings with the Affordable Care Act was much higher on colorectal screenings than it was for breast cancer screenings. So they saved a lot more, so people were maybe more willing to do that one than breast cancer. And it also, breast cancer usually doesn't affect men, and men are less likely to have any kind of screening preventative care. They're just overall less likely, so they think that might also be part of the 8% increase, whereas the breast cancer didn't. A sort of negative, journal article from the Preventive Medicine reports that in 2012, there was little change in preventative services overall for seniors with Medicare in the areas of endoscopies, flu vaccines, and routine blood pressure checks. This could be due to the fact that most of these people, already had Medicare before that, and they already had, or other insurance cares, and so they didn't need these, or they'd already had them, and that there's also still some barriers in healthcare about referring patients for screening, even if there's no signs that they need it. So just completely preventative healthcare is still kind of not necessarily new, but it's still not widespread as much. The third article in support of the Affordable Care Act is from the American Public Health Association. After the act was put in place, the amount of people that didn't adhere to prescription refills they needed due to financial issues dropped from 5.4% to 3.6% from 2010 to 2014. Part of this is due to the Medicare Part D that came about in 2006 that sort of worked on lowering prescription costs, but the Affordable Care Act effectively cut the percentage down from 2% in the 4 years after it was implemented. So that made a big difference in helping patients that needed prescriptions be able to actively get them and not have to worry about paying super high fees. I did read a little bit of some problems with younger adults had with the Affordable Care Act and how there wasn't really a decrease in the amount of uninsured people under 40 after the Affordable Care Act, but I think that for senior citizens, it really was a big help. I think that proactive and preventative care is really important and is some of the best things that you can do for yourself, especially as you start to age. And so lowering costs for these services was a big help. If you have someone that finds out that they have cancer at stage 1 instead of stage 3, overall, you're going to spend less money as the patient on treatment. If they can find it quicker, they don't have to do as many invasive procedures. And then also as the government, you're going to be spending less money on those more conservative care methods than you would on surgery and chemo and that kind of thing. So I think that it really was helpful. And I think especially usually older people aren't as... In my experience, I found that older people aren't as excited to go to the doctor, especially when, like, nothing's wrong, I feel fine. So that this was a really good way to help them, like, if they didn't really have to spend money, to help just make sure everything was going okay. So I think the Affordable Care Act of 2010 was very beneficial to senior citizens, and I'm going to include my sources so you can look at them, and also look at my cute little dog just sleeping on the bed. Anyway, that's all. Thank you.